Hi everybody, this is a video about two questions. One is about whether Borrelia can be eradicated from the body, and the other is about the safety of chelation therapy. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please ask your healthcare provider for that advice. And also, if you don't mind taking a quick second to either like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So a couple of questions in just a little bit more detail here. One question says, I'm still left wondering if Borrelia can be completely eradicated from the body, or do people simply go into remission? Please, we really need an answer to this. And fair enough. I mean, if I had borreliosis, I was suffering a lot of health issues, I'd want to know about that too. It's a really, really important question. I believe I have posted a video with this before, so if you're so inclined, you can search in the archives. Probably easiest to search my YouTube channel, because you can search by keyword more easily there. And I feel free to check that out if you want a little bit more information. But I think the gist of what I said in that previous video is that it's hard to say whether or not Borrelia can be truly 100% eradicated from the body. I mean, clinically, I've had patients, many patients now, who have a history of borreliosis. They have lots of symptoms. We treat them, and they don't have symptoms anymore, and they have not had a relapse. Now, I can't predict the future, unfortunately, make life a lot easier, but as best I can tell, patients who have been in remission for, 1 year, 3 years, 5 years, it's pretty darn encouraging when we see that they're in remission, they're not having symptoms, they don't need ongoing treatment, and they're doing really well. So again, can't predict the future, but for a lot of those folks, it looks like there's high hopes that they are not going to be afflicted by those issues again, or by Borrelia again. I'm sure they could get a reinfection from subsequent tick bite or whatever might pass the Borrelia into them, but it seems like we've dealt with the issue at hand. These are patients where they have had notable stressors, whether it's physical stressors, emotional stressors, they get exposed to mold again, whatever it happens to be, and they have not had a relapse of the Borrelia symptoms. So now I've had other patients where they seem to be good, and then they do have a stressor or an exposure to something else, and then they have a relapse of symptoms. That does happen, but where I've had patients where that has not happened, they have not relapsed despite stressors, and they are doing well for years on end. I think those patients are about as cured of Borrelia as they can be. Now, is there still Borrelia in their tissues? There could be. There are animal studies that have been done on monkeys, basically where they had Lyme, they treated them for Lyme, and then they killed them and checked investigated their tissues under a microscope, and they found residual spirochetes, sometimes completely intact spirochetes, a significant period of time after they've been treated and then killed them. They found the spirochetes, or they found these things called outer surface proteins, or the OSPs, from the Borrelia in the tissues, and those OSPs could very well be triggering an ongoing inflammatory or sort of immune dysregulation reaction in the body. So there can kind of be this like specter that's left behind of Borrelia, even if those spirochetes aren't still there. Unfortunately, the testing that we have available to us is not, to my understanding, is not able to definitively tell us whether all the Borrelia is gone or not. Antibody testing isn't going to tell us that. ELISpot testing, which looks at T-cell mediated activity, is not going to tell us about that. And PCR testing, fish testing, like there's a whole bunch of different tests out there, and it's there's no test that, to my knowledge, is able to definitively say there's definitely no Borrelia in the body. So it's kind of a combination of hopefully seeing negative test results coupled with no more symptoms, and that's about as much reassurance as we can get. In my mind, sort of a functional way of testing to see if there's still Borrelia in the system. So say patient's been treated, they're feeling really good, and we want to know, is there still Borrelia? Well, yep, sure, run some labs, hopefully everything comes back negative, but it's not a guarantee there's nothing left in the body. But then if that patient's able to tolerate a really high potency antimicrobial therapy, and I would say not pharmaceutical, like not antimicrobial therapy, because of course antibiotics can be associated with side effects. Sometimes like I'm feeling crummy because I'm on antibiotics, but using say high dose herbs combined with strong biofilm disruptors, and then for me, where I'm such a huge fan of low dose immunotherapy, for patients that is indicated for, it's just a game changer for them, using a full potency dosage of Lyme and co-infection, or Borrelia and co-infection low-dose immunotherapy formulas. That would be a really if a person doesn't have any Borrelia left on their system, then in my clinical experience, they should be able to tolerate, say a 2 to 4 week regimen of all of that and feel no different whatsoever. If they start feeling really crummy, well, then it looks like maybe there were some biofilms hiding things out, or still some infection afoot, basically still some immune dysregulation afoot. So that's kind of my functional way of testing, but again, no definitive way to know that Borrelia is completely gone. But based on what I said earlier, I think that it's quite plausible that it is gone, or it's at least like been beaten down into sort of hiding, chased into hiding to the point where it does not seem to be able to come back out again. So thank you for the question. I wish I could say definitively, yes, there's this test or this way to know for sure, but there's not, to my understanding. Now, anyone listening, if you know of a test or some methodology or whatnot which does show that Borrelia can be definitively removed from the body, or not definitively removed, which would be kind of a depressing thing to learn about, but better to know the truth than not know. Post in the comment section. Let me know. Let us know. Other folks look at the comments too, so be curious to hear if folks know things on this topic that I didn't mention. I wasn't planning to talk for quite so long about that topic, which is why I said I'd answer 2 questions, but the other one I think it'll be pretty short, pretty quick answer. So the other question was, are the dangers of IV chelation in Cutler's protocol real? So there's an individual there, I don't really know what his background is, but his name is Andy Cutler, and my understanding, as I've looked at it, he's got this protocol. They call it the Andy Cutler protocol, very appropriately, and it's a protocol for getting rid of heavy metals. And I don't know Andy Cutler. I certainly don't speak for Andy Cutler. But my understanding from what I've seen from his materials, and I've had several patients ask me about this over time. I've looked at his website and the protocols that they're following and whatnot. That the take home that I've received, and again, this is just my interpretation, is that he has some concerns about the safety of just kind of more standard chelation therapy with, say, intravenous DMPS and EDTA, and maybe higher doses of DMSA and other types of chelators. And I believe the concern is around maybe mobilizing heavy metals and basically creating more problems than you're solving, basically. So where the question is, are the dangers that are outlined by Andy Cutler real? Again, I don't speak for him, and I have not done a deep dive into what the information he's put out there, and I would, again, not presume to speak for him. In terms of some of the concerns that are raised there, like from what I've seen around like potentially seeing organ damage and redistribution of metals and creating a lot more symptoms and whatnot, I haven't seen that in my practice. We regularly run, as we're doing chelation, especially for folks who need prolonged periods of chelation, we will intermittently run tests to make sure that their liver function's looking good, their kidney function's looking good, that their complete blood count, like red blood cells and white blood cells and everything, are looking good. I've never seen any lab abnormalities pop up after doing chelation therapy, and we've chelated, we've run thousands and thousands of chelations here at our clinic. We've done that with many patients over the course of time. And so I haven't seen any issues that I can tell are related to any kind of organ damage or anything like that. And then I also don't see new symptoms popping up in patients who are receiving chelation. Now, granted, there are the occasional patients who do have some symptoms that pop up when chelation is happening. They might see a worsening of pre-existing symptoms. There might be some new symptoms, like I've seen some skin reactions pop up in a handful of patients over time, maybe some brain fog or fatigue that they didn't previously have. But then when we back off on the potency of the treatment, those symptoms go away. So I've never seen any lasting symptoms arise from chelation therapy, and we virtually always do like the full-blown, full dose, based on kidney function and weight and all that good stuff. But like we do like robust dosing of intravenous and oral chelation. So I don't use like a low dose protocol, which to my understanding with the Cutler protocol, it's quite low dose with oral DMSA. So I haven't seen the issues, but at the end of the day, like I'm very open to new information, and if I was to have the opportunity to talk to Andy Cutler, I'd be curious to know more about the specifics or seeing some case reports or things like that. But just in my, I would say, extensive experience. I mean, he might have way more experience than me. I don't know his numbers or anything, but I've been chelating for about 12 years now, give or take. Again, overseeing thousands of treatments. I think that it's a really safe therapy when it's indicated and done appropriately and all of that good stuff. So that's my opinion on that one. Thank you for your attention. If you have any questions about any of these topics or questions about other things related to chronic health issues, or even things not about chronic health issues, if it's health related, don't ask me for life advice, but if you have health related questions, please feel free to post in the comment section below. And otherwise, I will leave it there for now.